Let's continue the conversation now and get a bigger picture of the number of infections across the globe. Silindelo Masikane joins us at the video wall in Johannesburg. How's it looking, Slee?
Thanks, Shahan. As things stand, the global number of reported cases of the COVID-19 virus has surpassed the 100,000 mark. Now, the coronavirus, or COVID-19, as is known, is also affecting 103 countries and territories around the world. It's also affecting an international conveyance, which is the Diamond Princess cruise ship harbored in Yokohama, Japan. Now, if we look at the epicenter of where all of this began, we're also looking, if I should add, Shahan, at around 3,600 deaths. Now, 5 new countries, Colombia, Holy See, Peru, Serbia, and as well as Togo, have reported cases of the COVID-19 virus in the past 24 hours. Now, let's take a look at the epicenter of where it all began. China now sits with well over 80,696 cases and is also sitting at around 3,090 deaths. Now, outside of China, when we look at the top 5 affected countries with the highest numbers, we are looking at South Korea coming in with 7,313 cases as well as 50 deaths. Italy is coming in second with 5,883 cases, but they're recording the highest number of deaths thus far with 233. That is outside of China. We're also coming in with Iran at number 3. That is recording 5,823 deaths as well as 145 deaths. France is coming in the hundreds with 949 cases as well as 16 deaths. And then we have Germany with 847 cases. However, they have not recorded any deaths. Now, let's take a closer look at our continent. We have 8 countries on the continent that are affected, several in West Africa. Starting with the highest number of confirmed cases is Egypt. They're coming in with 48 cases. Then we move on to Algeria, that has 17 cases, Senegal with 4, South Africa now coming in with 3, Morocco with 2, Nigeria with 1, as well as Tunisia and Togo coming in with 1. And if we now take a closer look at our situation here at home in South Africa, the first confirmed case was, of course, on the 5th of March. The patient forms part of a group of 10 South Africans that went on a skiing trip to Italy. Now, the second confirmed case then was in Gauteng, and that patient, who's a woman, had direct contact with the first patient. And today, of course, 24 hours later, we now have the third confirmed case, which is back in KwaZulu-Natal, and that is the wife of the first patient who was confirmed. We are, of course, expecting the results of the other 6 group members who had traveled to Italy with the other group within the next 48 hours. Now, you can stay up to date on the latest information on the COVID-19 outbreak, which is available on the World Health Organization website, as well as through your national and local health authorities. So take care of your health and protect others by doing the following. You can wash your hands frequently, maintain a safe social distance, so that's around 3 feet or 1 meter. Maintain at least, you can also, of course, you need to avoid touching your eyes, your nose, as well as your mouth. Also, please practice safe respiratory hygiene. This means covering your mouth and your nose with your bent elbow or a tissue when you cough or sneeze. Then, of course, please do dispose of that tissue immediately. If you have a fever or a cough or have difficulty breathing, seek some medical care as early as possible. Also, there is a helpline here in the country for anyone looking for more information. That number is 0800 029 999. That number again is 0800 029 999. Back to you, Anli.